We have everybody in the room?
Yeah, I think so.
All right, let's hand this off to Travis and his team.
Well, thank you, Denise. Good morning, everyone. Happy Thursday. It's windy outside again, or it will be. Chances of storms today and tomorrow, though. Is anyone excited about that? I mean, not for any like damage, not looking for people's trampolines and roofs to be ripped off, but if we get a little bit of rain in the mix, I think that would be a good thing. So let's see. So this morning here, welcome and introductions. If everyone could get a chance just to, in the chat, just to put your information so we can just have that captured for the meeting, I would really appreciate that. I don't know if we necessarily want to go around. Denise, do you want us to go around and have everyone give a chance to introduce themselves virtually here still, or should we pass on that? What do you guys think?
Totally up to you. Maybe a thumbs up. Do people want to do that introduction? Thumbs up if you'd like to do some introductions to get to know each other. And I'll let you read the thumbs up. How's that, Travis?
Fair enough. I am not seeing a ton of thumbs up. So, or there's one, I see some. I think this group is starting to get a chance to know each other a little bit better. So maybe we will pass on the formal introductions. It always gets a little bit tricky trying to jump over each other and figure out who's the next person to introduce themselves. So, but if for any reason someone feels the need to sporadically introduce themselves, we would appreciate that as well. But anyways, thank you all for joining us this morning. We've got a lot on our agenda, as you can see, just kind of going over our purpose. We want to announce our new leadership team. We want to be able to prepare a launch of a work group in May, and then to be able to preview and talk about our collective, our communication plan. And so through that, we're going to spend some time this morning doing an update on the work of the backbone. Nadia will walk us through that. I'll get a chance just to talk about our new leadership team, and then have a question for you all as to what we hope to accomplish, so that we can start creating some vision and some timelines as to making sure that we're staying on track with the expectations of this group. And then I know that Michelle and other of the staff members will help us to be able to hit that and kind of visually keep us on track as we go through with the larger group as well. And then get a chance to go through a number of different things relating to launching that work group around children, youth, and adolescents, and what that all means. And then Michelle will walk us through kind of what that communications plan will look like. And then I think we'll get a chance just to kind of finish up. So that's kind of our plan for today. Is there anything else that anyone would like to have added to the agenda today? Okay, then we will turn it over to Nadia, and she'll give us a little bit more of an update on the work of the backbone structure here.
Good morning. I apologize, I'm on the road, so I don't have video so that I can stay with you on audio. My name is Nadia Sadi, and I'm the current chairman of Buffalo County Community Partners. So as far as an update on the work of the backbone, so the board has spent some time the last 2 meetings reviewing our current committees, the bylaws that are in place, and then also the language and the committee charters, just to ensure that they are fitting for today's work, that they align with the plans that we are talking about, and making sure that that structure is in place moving forward with this group. So specifically, executive committee, planning and measurement, resource. We have a new committee, which we feel aligns very well with the collaborative, that is planning, engagement, and communications. And so we've spent some time just looking at those things and making sure that they align. We have also worked on our mission statement. I don't know if Michelle, can you pull that up? I don't have that in front of me, but we've worked on reviewing our mission statement. And
Yeah, I just dropped it into the chat.
perfect. Yep. So our new draft, and we would welcome any input from anybody on this call, as well as building connections among community members who share the passion to measure, promote, and strengthen well-being in Buffalo County. So we've been through a few drafts, and we're going to just sit on that one for a little bit, let it marinate, and see if any changes come out of that. So that is all I have for the update.
Okay, thank you for the update. So to move on, to get a chance to talk about some of our leadership structure, recently we've had and asked of this group to see if there were additional members who were willing to take on the additional time and responsibility to help lead this together as a group. And we did have some folks that have stepped up, and I really appreciate being able to have Jamie, Emily, and Abby who have agreed to do that. And so maybe I know that we skipped kind of full introductions earlier, but I would ask each of them maybe just to introduce themselves again, and maybe just say a little bit of why they have agreed to do this, or why this work is important to them. Who'd like to go first?
I can start, so you don't have to call on anybody. My name is Emily Lehman. I am a community engagement manager for Unite Us. I house in North Platte, but I have previously worked a little bit in the Kearney area. My background is in state government, CPS mostly, child support enforcement, Department of Labor. So a pretty diverse group of individuals I was working with in my past life. So with my position at Unite Us, I just have a passion to make sure that people are connected to services. And as part of that, we have the data to support what the agencies in our communities are doing. And a big part of that right now is that social determinants of health aspect, which I didn't totally understand that when I was a CPS worker, that we might have removed kids for a parent having a mental health issue or a supervision issue, but it was often much bigger than that. And we only addressed one need. So there could have been a housing need, a DV need, a food insecurity. So I'm really excited to have agencies in the Kearney area and across Nebraska have access to our platform, and then have that health equity information available to the agencies that are using to support the work that they're doing. So I'm happy to help lead in whatever capacity is needed.
Thank you, Emily.
Mm-hmm. I can go next. I'm Abby Olson. My background is I have a master's in social work, and I am the director of care management and social work at Good Samaritan Hospital. I've been here proudly for 15 years. I've got to work with all populations, which is why I like healthcare. I can work with new parents and then potentially go work with somebody at end of life and trauma, and definitely understand the connection between physical health and mental health. And much like Emily said, lots of social determinants of health. And part of my, I love community collaboration. This group is pushing me to think bigger than I'm definitely like to focus on barriers and breaking down barriers, but sometimes it's hard for me to look at things from the big sky up above us. So this has been a good challenge for me, but something I need. And I really appreciate having the opportunity to advocate for others. Access is a very big thing for me. And also being able to just connect people to all the resources that we luckily do have in the area. And then my side gig is I also am an adjunct professor at UNK, and I teach a medical social work class there. So kind of get a wide variety of people I get to work with. So, and thank you for this opportunity. I do appreciate it.
Thank you, Abby.
I'm Jamie. I work at Family Care. I started here as a family peer support specialist, but my background is really as a parent who has kids with mental and behavioral health challenges. So this work is super important to me because in all the work that I've done in my own family and then with families that I've gotten to serve, it's really obvious that wellness comes in lots of areas of our life. It's not just mental health or, having those basic needs. So I'm excited to be able to elevate that experience and to make sure that families that are impacted by the initiatives that are done by this group are represented and their voices are heard in here. So thank you.
Thank you, Jamie. So that is kind of our new leadership structure for this, which will be great because there's a lot of work going on here. There's a lot of moving parts. And so to have a broader team of us who can help to coordinate all of that, make sure that we're making all of the meetings, we're staying on track, moving forward, not having to cancel a meeting or delay work because one of us isn't able to make it. So we're going to be pretty interchangeable as far as our ability to pop into meetings, lead meetings, and keep the conversations moving forward. So next, one thing that we really want to talk about, and this is something that I've pondered quite a bit, is what do we want to accomplish, or what will we be proud of if we look back in a year for us to being that we've done with this group, and to give just again a little, and I know that this gets a little bit repetitive, but for me, just to give the backstory of my involvement here, when Denise asked me to be involved a couple of years ago, we weren't a Buffalo County Wellbeing Collaborative at that point, and we were a different group, and we had kind of a different purpose, but it's definitely evolved. And as we got a chance to talk, Denise and myself and Matt presented at the Kearney Noon Rotary Club a couple of weeks ago, and I told the story of the very first meeting that I sat in, and I got a chance to meet Matt. He completely overwhelmed me because he had about 50 pages of numbers and data, and we hadn't quite gone through all of it yet, where we had made good information out of it, but it was just this data dump to be able to begin this work. And I was like, what did I sign myself up for? Like, what is going on with all of this? And so we were able to go through and to be able to take that data, turn it into information, understand some themes, so that we're at the point that we're at today, where we have that nice graphic where we understand our purposes, where our collective impact is, what are our focus areas, who are the folks that are involved with us. So we've come a long way since I've been involved over the last couple of years. And with now having pulled in this larger group, or before we didn't have this Buffalo County Collaborative or this steering committee of these 20 to 80 plus folks joining us for every single meeting. And we have a lot of very meaningful conversations about how we can have people involved. And I believe, in my opinion, we've done a good job asking that question over and over and making sure that we have the right voices at the table. And now I personally see us as, okay, we've got the table set. We could always add a few folks if we need to, but to a large extent, I think those conversations are behind us about who needs to be at the table and who's there. And I think it's time to start doing more of the work and having those meaningful conversations about how we accomplish this collective impact. And so as we're taking a look at moving from making sure that we've got the right people at the table and going into a period where we're starting to have work groups and being able to accomplish some work, what does that success look like for us? And I know that's quite a buildup there, but I would just ask this group for feedback as to, if we're looking back in a year with, knowing where we're at today, what do you want to accomplish, or what will you be proud of with this group a year down the road?
A couple things, this is Abby, that come to my mind is just sharing our mission with more community members and people that may not know of the great work that is being done, which will hopefully then increase, we would have more engaged partners, maybe even new partners that come to our table. And then I think just being able to have a more efficient and effective way of connecting our community members to resources without having a lot of duplication. because I think it's important to sustain the resources that we have and not overstress others. And I think that comes through duplication sometimes.
Thank you for sharing that. I agree. I mean, that's one of my personal things. And I think one of the main reasons that we're being pulled together is because we want to communicate and share that mission and our vision, and then being able to connect folks and stop with the duplication that we have currently going on within our region. That's great.
Travis, I would like to add, I guess, how do I want to frame this? Maybe light fires, inspire community to be innovative. One of the things that is still resonating with me several months after learning about our lack of dental care for people who are on Medicaid. So that still is, yeah, it's still sitting with me. So just being creative on how to meet those kinds of needs.
I think that's a really good point, is how do we inspire folks? Because once they feel inspired, that's when they're going to be motivated to do something. We can't tell someone, hey, I want you to be motivated towards this cause of dental care or whatever it may be. They have to feel that intrinsic factor for them to be able to be motivated and go do something. So how do we create that environment? That's a great point. Thank you.
I would like to see us help find a way to close the loop when social determinant of health is made. How do we close the loop and let all of those involved in that know that we have done that? And how do we follow that up?
Can you give me just a little bit more, maybe of an example, or what are you thinking when you say closing the loop?
I'm a physician, and so I see a patient in the office today, and I mean, I ask a few questions. My staff and I, acting as a team, ask a few questions. It becomes obvious that there are issues with housing, there's issues with food, and I make a referral to an agency, but I never know what happens. So when I see that patient come back in 2 weeks or a month, how do I make sure, is there an easy way that I can make sure that I know that this person has contacted or been contacted and what actions have been taken, so that I don't have to reinvent the wheel again and ask that same question over and over?
Yeah, I think you make a really good point, Dr. Schaefer. So, you know, as a physician, if you order some sort of a test, a lab or a radiology exam, you get a result back on your patient. You understand you've ordered something, or you've tried to connect them, and then you get a result back. When you're looking at something more community-based, like you're talking about the social determinants of health, you may make a recommendation or an order, but there's no feedback as to whether or not that service was completed or what the result of that was.
So, and I would tell you, it doesn't strike me as a lab order. It strikes me as a therapy order.
There, yeah, okay, thank you.
So it wouldn't be like ordering a test. This is like referring somebody to physical therapy. This is like referring or ordering a medication. I want to know that they got that medication. I can look and actually find that information. But what I really want to know is, you know, are we closing the loop? Did we do the things that we were supposed to do to make sure that that patient is taking the medications and having the effects that we wanted that medication or that therapy, that treatment? Because I look at this, a lot of the social determinants of health are almost like some of our therapies. Is how do we know that they work? I mean, that's the bottom line.
I would
is we-
second that. We're all doing so much work.
And
And
we don't, I agree with Abby, we just don't know some of the time.
yeah,
I mean, Abby may do something in the hospital, but then that patient leaves the hospital.
mhm.
And how do we know that that's getting followed up in the community?
Yep.
Who's responsible for that? And that becomes the real issue, is that closing the loop and responsibility. So there's got to be some type of communication that we've got some type of communication among the different, you know, interventions that we're making in this family or in this person's life.
Yeah, I agree. I think that's a great point and a great example. Thank you for sharing that.
I'm Sarah. I'm new here. But listening to Dr. Schaefer, this is more of a concrete goal that we could have, is to create some kind of digital connection where whenever a resource is used at each of the establishments, that name goes into a resource use database where you can check when and where they used your resource, so that there's follow-up. And I don't know how the medical community would be able to put in names without violating HIPAA, but there's probably some way that they could at least access the name of the non-HIPAA protected services. And the Buffalo County social workers and all the other workers can find where what, when, and to whom. And it could be as easy as a sign up when you're using that resource.
Thank you, Sarah,
So
for
a digital organization platform, I guess, would be a successful tracking method.
I'm seeing a lot in the chat about Emily and Unite Us, and I know that we're not trying to solve a problem right now, but maybe Emily, can you just give us a little bit of your services and how that could maybe at least be an option for what we're talking about right now?
Yeah, I didn't want to monopolize the conversation, but Dr. Schaefer, everything that you said really resonates with me. So Unitas is a social determinants of health platform where providers log in if they're meeting with a client and there's a need outside the scope of what that agency does. They can log in and electronically refer that client to another agency that's on the platform. They can also share information out about resources. 211 is our coordination center as well. So referrals can be sent directly to another agency on the platform or to 211 to do the heavy lifting. And then our funder and partner is Sync Health, formerly Nehi. So they take care of the cost for community-based organizations to join the platform. Thanks, Denise. Yes, this is our home website. So the closed loop part that you talked about, we have that as well. So once an agency receives a referral, they are responsible for reaching out to that client and opening up a case with them. We have network standards, 48 hours to respond to a referral within the time that it comes in. And then that sending agency gets an email response back notifying them that a case was open. So at the end of the day, you do actually know that they made it to the next resource and that you've moved that off of your plate and you don't have to wonder if they actually got connected. So we have a large data repository from Sync Health. It's just contact information for folks because of their PDMP. They were put in place by state statute in 2008 to facilitate the exchange of that medical information between medical providers. So when you log in to create a client, their first name, last name, date of birth, and just their contact information is in there. But some of that health equity information too, ethnicity, race, gender, all of that is in there for us to really get some granular data to support the work that's happening too. There are a few users on the call that are on the platform. If you guys want to share anything else, I'd be happy to do a demo of the platform at some point for individual agencies or for this group, just for transparency purposes. But we have a lot of information and data to share, certainly, and it does make sure people are connected to services. So CPS, we used to, and a lot of agencies still do this, have our resource binder, give a Post-it note with a phone number to somebody, and we never really knew if they got connected to services. So really feeling uninformed about what was happening with them. And again, we were only probably addressing one need when there were multiple needs. So that social determinants of health piece. So I don't know if anybody has any questions. A lot of you have probably already seen a demo of our platform, but I will be doing a demo and a presentation for the Kearney Community Connections group in June. Thanks, Denise, for sharing some of that information. I appreciate it.
Maybe we can get, when we send out our next communication steering committee, maybe we can get that information of when Emily is going to be doing her presentation, and if, I don't know if that's appropriate or not to invite members of this group, or if we need to set up something separate for people to be able to understand that. So
yeah, we also have community information sessions a couple times a month too, on different days and times that people can join as well to get more information. There's a demo during that as well.
Well, thank you for the quick the quick information there on Unite Us. I appreciate that. It was very timely. All right, we've started to get a good list here. Are there other things that we should be looking at that we'd like to be able to accomplish, or how we would be proud of ourselves of the work that we've completed within the next year?
Yeah. Hey, Travis, this is Diane Duffin. I'd like to add to the list that a year from now, I would like for us to have a common language and common set of measurements for evaluating impact, and some kind of platform for sharing those data across our organizations. And if we don't have it in a year, maybe we've got significant progress toward having it.
Yeah, this is just me personally, but my brain loves to map things like that, of having a simple one-page infographic dashboard that can be able to show, to be able to take what we've talked about here and be able to turn it into what we call, or what you call, a SMART goal. We've got something that's simple, it's measurable, it's attainable, it's realistic, and it's also time sensitive. So we can actually measure success. We don't need to eat the whole elephant if we don't think we can accomplish the bigger. I mean, obviously the work of this group here is larger than 1 year, so we may not be able to attain everything within the first year, but maybe we can chunk off a piece of that and have something that's realistic, and that can be a piece that we can use to be able to share with other agencies and the community at large, to be able to show what we're doing and how we can demonstrate success along the way. Other feedback. We were a little slow out of the gate. There's always that 30 seconds of awkward silence of who's going to speak up first, and then Abby broke the ice for us, and it's just been water on board ever since. It's great, thank you. Okay, so I know that the staff will be able to take the information that we've gathered so far and be able to hopefully turn that into some goals for us. So I appreciate all of the work that you guys do. We'll move on then. So being able to talk about launching a work group for the children, youth, and adults, I will turn it over to some of the staff to be able to give an update on how the pilot meeting with Positive Pressure went, and maybe some of the outcomes or feedback from there.
All right, I see my name first. That's what I thought. Maybe I was going to start off. I didn't know if Denise was going to set me up though, but I think Travis did that. So our positive pressure group, for those of you that are familiar, has been around for a very long time, working on substance abuse prevention strategies in our community. And we paused our work back in the fall, early winter, to focus on this big picture, well-being collaborative. And we decided we wanted to bring them back together at the beginning of April to check in, see how things are going, and more than that, test some of what we're doing in this group to get people to think about the balcony level of what prevention looks like. So we invited our core group of positive pressure and some of our other partners that had been on some of our unconnected youth conversations, our opioid task force. So kind of pulled a few different groups together to meet and talk through what their idea of, what substance abuse prevention can look like moving forward. So we got a lot of good feedback from our partners. We got some energy around thinking more upstream prevention. We talked a little bit about, how we've started using some of the strategies like second steps to address the social and emotional learning curriculum, but now we're even looking at how do we even go further upstream and getting those substance abuse prevention messages and strategies started earlier. So that's where Tana came into play. And that's why we think that this group maybe can pull in the early childhood folks that she's working with, because we're all hoping to do the same thing. And that's introduce those substance abuse prevention strategies earlier, so we have better outcomes later on. So Tana, I'll go ahead and let you share a little bit about the early childhood perspective.
Yeah, I think just thinking back on that meeting, and I'm not sure who started it off, but I know Doug had been talking about, the programs that he's involved with and has funding for through county aid. And then just talking about that gap where those funds are they're only able to serve ages, I think it's 12 and up. Doug, correct me if I'm wrong, it could be 11, 12 and up, to prevent youth from entering the system, those prevention pieces. And then we had another partner, I think it was Tracy with CHI, who also provides some just prevention and some presentations to different area schools. She might not be in all of the schools, and just talking about, what ages she serves, and then what ages, some of our other programs serve, and just kind of how some of those gaps are in there. Thank you, Doug, ages 12 to 18. And so, there's a lot of great things going on, and we might even be doing some of the similar, social emotional curriculum, but it's only in pockets, right? And it's only age pockets, or it's certain schools. And so I think that just led to the conversation of how important early childhood is, because we are reaching all those children at some point. For example, I see Aaron's on this call, ages 0 to 3 with Sixpence childcare partnership. And then we have Rooted in Relationships, where we have coaches that are working with childcare providers to kind of help with some of those strategies to prevent problem behaviors and just social emotional skill building. But beyond that, we also have opportunities now through Nebraska Children and Families, where we're able to provide early learning scholarships to our parents who they don't meet that subsidy requirement. They might but they're still having a hard time paying for childcare. They might have 30% of their family income going towards childcare. So we're able to help that whole family piece. And then it just kind of keeps sparking that, how early childhood is so important in preventing, substance abuse and some of these other issues down the line. And I think along with that, we also talked a little bit about childcare expulsions. So I don't know if many of you are familiar, but childcare expulsions are much higher in those earlier years. And actually Buffalo County has one of the highest rates, or we did in the last year, compared to the state. And when we expel a child from childcare, it's usually due to problem behaviors. And then we're also, creating problems down the line, right? We're taking them out of that safe place, maybe that safe environment with that childcare provider, or that connection that they've been making with that loving and caring childcare provider. And it does just kind of have that trickle effect down the line. So it was really just opening this conversation of, we haven't always had that, not necessarily the understanding, but maybe even just that opportunity to talk about how important early childcare is. When we're talking about substance abuse prevention, right? When we're talking about maybe things that are going on later on in life. So that's kind of where we were just talking about some of those different ages and programs that open the opportunity to talk a little bit about early childhood.
And Tan, I'm going to jump in just a little bit too and say, in a typical positive pressure meeting before we started this work, that question would have come up. How early of prevention do we need to start? And Tracy asked us that question. She goes, when's age of onset? Because as a prevention person, I want to know that I am putting the right dose at the right age to be able to prevent substance abuse prevention. Not having those early childhood representatives in that meeting at that time limits us in that conversation. So the pilot really proved how important bringing everybody together in this work group to ensure that we can continue to keep talking about what that work is around early childhood as a whole prevention system. So thank you, Tana, really good work.
And I think the piece that I was going to share in was that during the positive pressure meeting, just one of the notes that we had listed on here of what we hadn't heard is that inclusion is often an afterthought. We want to make sure that we're inviting partners for this to be at the forefront. And so that would include people from lived experiences, the parents, some of the youth that are able to advocate for themselves and the services that they're receiving, the barriers that they're seeing, ideas that they might have to just better streamline services for them and their families. And so that was just one of the pieces that I wanted to mention from the observation during the positive pressure meeting.
And I was going to share on behalf of Josh, so forgive me as I try to read some of his chicken scratch. But he wanted to share, that the Photo Voice has, I think he said about 24 youth engaged at the Haney and Rom Center, and has been serving 4 youth at our offices. He's, been saying that, youth have been coming in and sharing the issues that they're seeing in the community. And I think their focus this past time has been around mental health and actually substance abuse. And, his thought and concern is, how do we share their voices with others, getting the youth to the tables to talk with partners and adults, not necessarily always just, the kids tell Josh and Josh tells, everyone else. And he was asking, how can partners around our tables engage with the youth, maybe at the ROM Center, or, come and share things, interact with them, and just make that, adult youth connection in the community. Just so there isn't, that disconnect between the youth and some of the partners and adults in our area. And I know Sheriff Miller had also shared that he's going to be joining the state opioid task force, and looking for connections there about things we can do in tandem with them. And Chief Waugh and KPD also shared that they want to help families in the community in any way that they can, and they might have some funding there too. He shared that they're more than happy to help, but they don't necessarily always want to be that first call, tying back into that prevention piece. There's some things, resources to know, and things for people to get some assistance before just always, having to call law enforcement. They don't necessarily want to be that first call, just if there's ways to, prevent those people from entering the system in the first place, if that makes sense. Anyway, I think that's all Josh had.
Great connections, Matt. And thank you for covering for Josh. He's actually has a Photo Voice class this morning that he's covering. So really good information. And I think I'm going to just stop for a minute and talk process. So as staff, when we debriefed on this piece, we said what typically would have happened before we started this collaborative is all of that information would have come back to staff and landed on staff desks. And then we would have been trying to figure out how to make some of these connections and who needs to hear that. So with the collaborative, having all those players at the table, they're going to be able to hear from each other so that everyone hears that Sheriff Miller is now on the state opioid task force. So think about how that kind of connection will help many others who maybe are working in this prevention streams. The one thing I think I walked away from, and this is, I'm just going to use an example of two good friends that we have that are strong partners. Katie with Two Rivers Public Health Department was in the meeting, as well as Nikki Bull from the CHI Pharmacy. So what Wanda did to start the meeting, and I think this is another key process piece, the thing she asked everybody to answer is what is your hope for prevention in your community? And so that's what's inspiring all these conversations that the staff is sharing with you. What I heard Katie say and what I heard Nikki say is we are focused on adults. So everything you've been hearing from the staff so far has been around youth and children. But those two entities both said our job is to work with adults, and we have funding to work with adults, or that's our focus or our mission to work with adults. And then after they both individually said that, Katie had one strategy where she said, we're going to start hiring more of like a navigator in the community to start going to all the AA meetings, to start ensuring that resources are available for those who are in AA meetings. And then Nikki, on the other hand, said, what I would love, this is what she said, what I would love to see in our community is the ability for providers to have resources and information in their hands to hand out to people when they're prescribing prescription drugs. So it was like that piece that kind of clicked in both all of our staff minds. It's like, if we could just have a little bit more time to have Nikki and Katie have those conversations, or just bring a connection to them to say, gosh, you're both working in adult realms and you're both working to the same means. What would that look like when you start sharing the same data and working towards the same means? And actually, in taking what you guys just said about the feedback loop and how Unite Us could be a part of that, it's just like puzzle pieces start clicking in, right? For all of us, it's like, oh, I could see how that could happen and how that referral could happen and how the whole system could be identifying more gaps and bringing us closer together. So I'm going to hand this off then to Michelle.
Thanks, Denise. And we already heard from Martha and a few others on the call, kind of who was missing from this conversation. So I won't keep going into that, but I think the important part is our collaborative backbone. So the board of directors, we're starting a new group that wants to look at engagement in the collaborative. So hopefully this board group can be looking at who's missing in this conversation. You know, I would have loved for Aaron Small, I see you on the call here, to be in on that conversation, talking with Doug and with some of these other people, right? So hopefully our backbone, the board, can be addressing who's missing on these calls, and we can like keep that work moving forward.
And just as kind of an overall summary here, we've talked a little bit about, you know, we did identify those gaps and we did start to see those connections. I heard several partners say, you know, we'd like to know how we can get into schools and we'd like to know how to connect back to early childhood, and just all of those conversations that started happening. It looked a lot different than what we've normally talked about at our positive pressure meetings. And I think that those conversations hopefully will lead us to moving up towards those impact statements that we've been working on. So I think it's exciting the way the Positive Pressure Coalition has been used in this manner to kind of be the pilot to try out this model that is much different than the way that we used to run our meetings.
So to wrap up, what staff's oversights and key learnings from running this pilot with Positive Pressure to enable all of you to kind of decide what this looks like moving out with a full work group launch. The one piece that I think the leadership of your steering committee, the last time we were having a conversation, it seemed like this was a gap of missing information that I don't think I've been real clear with. And so with the staff, we've been talking a little bit about a pyramid where at the top of the pyramid are those two impact statements. So if we could create a visual that starts to put those impact statements at the top of the pyramid, the next level of that pyramid is what are those performance measures? What are those funded prevention strategies that are funded by community partners and maybe other strategies in the community? What is in the middle of that pyramid? And what's lifting it all up and at the bottom of the pyramid is our population health data, right? How often are people drinking, smoking? What's our poverty rate? What's our unemployment rate? It's just all those social determinants of health, population data that is at the bottom of that pyramid. So I wanted to share that because it seems like that was kind of a missing piece of information that we haven't been real clear communicating. So we kind of wanted to wrap up with that as kind of a visual of moving forward. So anyway, that's, Travis, that we wanted to share as a staff team what we heard to help inform all of you in kind of rolling out this next piece. And I think I need to go back to the agenda here just to make sure. The staff is also recommending, and I don't know if this is the next piece on the agenda, but I'm going to share anyway. What the staff was going to recommend is that we look at the May collaborative meeting. So the full collaborative meeting, which will be the 4th Wednesday of May, that be the launch of our work group around youth, children, and adolescents. So that was one recommendation that we had as a staff team versus building a whole nother work group launch, using that collaborative time to invite people together, hosting that conversation, begin asking people what their hopes for prevention are for children, youth, and adolescents to really start off that conversation. So that is one recommendation that we're moving forward. We also have some recommendations of some potential leaders that we think would be good to lead that work. And we're very willing to share those names, and in hopes that the steering committee would say, gosh, this group or this person sounds like a great leader. I, as a steering committee member, am willing to go talk to that person, help train them, and help them get ready to launch this work in May. So I think that's kind of, we worked through a few of those pieces, Travis. So I think back to the steering committee as to what your role is in defining in these next steps of launching the work group.
Thank you, Denise. I guess before I jump into that, that was a lot of great information by the staff there, and there was a lot of comments and discussion going on into the chat too. Does anyone have any additional comments that they'd like to make regarding all of that information that was just shared? Okay. Does someone have the document that they can pull up to be able to look at the roles of the leadership team? So this was put together just to kind of help, speaking in advance, hopefully that I think it will be popping up on the screen here in just a second, but it was something to put together just to kind of keep some focus, make sure that we're identifying gaps within when we're having these meetings and these discussions, that we're focusing on the right areas and that we have the right people in the right roles. And so for our steering committee, some of our big picture ideas are for us to make sure that we're, again, providing oversight, leadership, and guidance on the discussions, the goals, our outcomes, making sure that we're keeping that meta focus on the impact, that we're not just, narrowing down into one area, but we're considering, like we just talked about with the staff giving the update, people from different areas and their respective backgrounds being involved in that. And of course, you can see support for the collaborative, making sure that we've got this group being a champion of the efforts. So depending on what different work groups we have or different conversations that we're having, I think we have the expertise, and hopefully, as we talked a little bit earlier, we have people who have that passion, that intrinsic drive to be able to be champions for the things that we're talking about. We want to make sure that Matt is overwhelming us with data so that we can make good decisions moving forward, so that we're not, it's good to have that passion, but we want to make sure that those things are also rooted in some sort of information or some data to be able to show that there is opportunity, that we're addressing something that needs to be addressed, and that there's a way to measure some of that. Again, with the meta focus, I think utilizing our big picture thinking, making sure that we've got the proper alignment and that we're sustainable. And that's a big one for me too. And we've had these conversations in smaller groups as well, but there's a lot of conversation, there's a lot of time that goes in. I am well aware of the ask that we have of all of you to be able to do this. We've got the steering committee of the larger well-being, we've got the well-being groups, we're talking about launching work groups, and there will be overlap there. And so I want to make sure that we don't get fatigued, because we've got the staff that are really great and they're involved in this on a daily basis. But for many of us, obviously, this is something that we're passionate about, but we have these other responsibilities with our primary job or functions. And so I just want to make sure that we don't fatigue people out because they've got 5 to 7 hours of meetings every single month and they just can't keep up with the work. They're starting to feel behind or they're overwhelmed and they drop off. So I open people to be able to, hopefully this group feels free enough to be able to share thoughts regarding that sustainability or any of these other areas that we just covered there. And then really for the leadership team, for those folks that introduced themselves earlier and myself, and this isn't necessarily where it's one person for each one of these areas, but for the conversation leaders, the recorder, the strategist, and the other items that we've got listed here, I think it's just to make sure that we have those things covered. We want to make sure that we're leading the discussion, that we're making sure that we are taking good minutes, that we are doing the basics, the blocking and tackling, keeping the meetings moving forward, keeping us on task, not running late, making sure that we've got good agendas for the time that we've got, and making sure that we're making connections and with the right people within all of that. So I'll just pause there for a second. Anyone else on the leadership team that has thoughts or would like to say anything? Jamie, Abby, Emily, anything that I missed there?
I don't think you missed anything. But what we also talked about was that like some of this within the role can be very fluid, and just making sure that we're involving other members of the different work groups in the meetings, so that not one person feels like they're taking on everything during a meeting, so we can kind of share that out. Other than that, you covered it great, Travis.
Thank you for your feedback, Emily.
I don't have anything to add. I think you both covered it. Thanks.
Got the
Thanks
thumbs
for
up.
carrying the team.
Okay, so I know that on our agenda there, it talks about the May meeting, that fourth Wednesday, I believe is what we talked about, being able to launch the work group. Feedback, after hearing the staff go through their information, talking about our roles and responsibilities, what is this group thinking? Or is that something that we're ready to do, is to be able to start getting a work group going and start to move beyond our structured conversations and getting into a point where we can start having this group do some of the work? I'm going to take a lack of feedback as compliance, everyone, just letting you know.
I see some nodding of heads.
Okay. Thanks, everyone. I'm just teasing you. Okay, then next on our agenda, it says being able to talk about inviting and training work group leadership team. Staff, can you give us some recommendations, please?
I believe Michelle has that, and I see her nodding her head. I'm going to just go from the top of my head of people we were talking about. Now, know that these are not people we've actually even talked to about this opportunity. These are just recommendations from the staff team. So I'll let you take a minute, kind of look through this list. It's a great list. We're thinking more than one or two, maybe a handful of maybe 3 or 4, kind of using the same model that the steering committee is using. We wanted to make sure and cover children, adolescents, early childhood, as well as law enforcement. You also see childcare providers, Chandra there. Your name is popping up there, even though we have not talked to you. But your area of education with adolescents was definitely an area and diversity that we brought up. And then Dulce Valdez with KPS migrant parents. So we tried to give you a broad list. Yeah, Doug Kramer, your name pops up there too. Jason Owens pops up there because he has been doing some great work with youth, and we thought he could help us bring that lived experience to the table. So these are names that we're recommending on behalf of the staff to be considered for leading the launch of the Children, Adolescents, and Youth Work Group.
And what would you do with this information if this group agrees that any one of those folks would be good to be able to do that? Would you reach out to a smaller group of those then and have, like you said, maybe 2, 3, 4 of them be the actual leaders? And to Tana's point too, if this group thinks that there is someone that would be good to be on that list that we haven't considered, please speak up and let's get those folks on there too. Doug, we appreciate your ability to assist. Your name does come up a lot, huh?
Yeah, and mostly in good situations, but I just wanted to thank everybody that's here today, but also the health partners for all the staff and people that do this. We have, and I haven't really said this very much, but I think when I talk to other people around the state who work with juveniles, they're envious of all the service providers that we have. And I kind of echo the thing about the communication stuff, and that's always stuff that we continue to need to be aware of, but to continue to work on. And that's one of the things this group I think is great at doing, is communicating. It's just, we always have to be better and say, let's communicate, let's help each other out. And I know there are opportunities that we can do that and not worry about divulging things that are confidential, but things that are going to help kids and families and make us all stronger. So thank you.
Thank you, Doug.
Travis, I do wonder if sorry, too many devices here. I do wonder if maybe taking a look at the existing steering committee to see who might want to lead this work, and then whatever gaps we have in that leadership, maybe go back to this list, have steering committee members maybe identify those individuals that would fill that gap and then approach them. Maybe just start with who we have here at the table today willing to do that work or fill one of those roles.
I have a quick question on the law enforcement side of this list. What if it was the community service officer versus your sheriff and the chief? Mm-hmm. Somebody that's in the schools on the ground. Just kind of some 2 cents there.
Aaron, I think why we brought Neil and Chief to that, because we want people who are going to draw people to the meeting. And I'm not saying that a school resource officer wouldn't be able to do that. They would. But I think we want leaders who are going to draw others to this meeting, people who will step up and say, I, as the sheriff of Buffalo County, want to see people involved in early childhood as well as young adults to have a conversation about how we can improve the overall health for youth in Buffalo County. I do believe the school resource officer should be a vital person in the conversation, but I think we need to look at those people who can invite others to the table and be spokespersons for the need to bring people together around a conversation about children, youth, and adolescents.
I do know that Chief Waugh and Sheriff Miller are, I won't say daily, but it's pretty close to that contact with all their SROs. And they know, they have that pulse, that heartbeat on what's happening in the schools. But it is the SROs that build those connections with the youth and are on the front line, so to speak. I hate to use that term because it's not good in my mind, but they have the day-to-day workings with the youth. But the chief and their different programs that they have to support and supplement SROs, they know what's going on. And to get them initially started, and I think once they start letting the SROs know what's going on, we'll have more volunteers from the workers who are working directly with the youth. But good point.
My husband's the sergeant over the SROs. So, I mean, I understand the department and stuff. I just didn't know. Sometimes we need a smaller voice. Sometimes I guess that was my point.
This is Nadia. I do have a quick question. Is it the intention or the vision that there will always be a leader from the steering committee on the work group? Just without using names, I guess, is that kind of the intended structure, that leadership from the work group will have representation on the steering committee?
Well, my personal thoughts would be yes, that from this group, in order to keep that connection, I think if we have someone from here that keeps us connected to that work, because not all of us will be on that work group. But that's just my 2 cents, I guess. Maybe I shouldn't have jumped in. Maybe Denise thinks Travis shut up.
I can back. I forget which device I'm speaking on. I can back that up with the conversation you guys all had last week, Travis, when you did share that some of you would like to be leaders of that launch group, and some of you said, no, not my space. But I think that combination of some of you being leaders in that workspace, in that work group, and some of you who are maybe already doing work in other space, it kind of comes back to what Travis was saying. You need to know what you're able to give to the work, and knowing that if you're serving on steering committee, can you give that leadership to the work groups?
So I think we've got a good list of potential candidates, and unless there's any other feedback, and if there is other feedback, that's great, but we would allow the staff maybe to start reaching out to some of those folks and seeing if we can get a strong, robust group of 3 to 4 folks on there. And I know that they're also taking a look in the chat, so that the comments made in there will be considered as we're taking a look at folks for that launch, the leadership group. I guess the next thing on our agenda is to be able to talk about what does success look like with launching the work group, or what will tell us that we've been successful. I'm trying to think, I guess, what are our expectations of the work group? I'm thinking that the work group should help with connection here, because we'll have members of the steering committee on that work group, and I'd like for them to be able to help set the goals of their own work. But from a bigger perspective, what do we see as success out of that work group, or at least in the sense of structure and accountability? Maybe that's something that we don't fully know yet. I mean, maybe that's part of that group kicking off and defining their scope more selectively, making sure that they've got the right people. For me, again, I don't know if it's so much about us defining what their actual goals are. Success for me is making sure that this group helps to make sure that they've got the right structure, they've got the right leadership, the right cadence, they're focusing in the right areas. And then from there, once we kind of set the playing field, let them go and be able to do what they need to do.
Travis, this might be a little bit vague. I hope I'm understanding the question right, but I think that success for the new work group, I think for me as a staff person, it is starting to make connections, to focus on I know we use the term like whole child, but the whole family system, right? How do we start making connections that if we're serving a family because they cannot afford their early child care, how do we connect that they may also be struggling in basic needs or mental health? And how do we get all of the partners around the table to be able to serve that family? And I think it goes back to what Dr. Schaefer was talking about and close that feedback loop. If we've got the family's attention in one area, how do we continue to build connections in the community to serve that family as a whole?
Yeah, I think that's great. I think that holistic view that this isn't a group that's going to, focus on just daycare. If we get a new daycare center in town, then all of a sudden this group has accomplished their mission. I think you're absolutely right, Tana, is keeping a more holistic family approach to this, making sure that we're servicing all of their needs and then connecting and recording that information for that impact. Any other feedback?
It sounds like there's a lot of repeat in the responsive services. So maybe if there's a way to combine a preventative service with a responsive service to prevent repeat, I think that might help facilitate this.
Thank you, Sarah. Yep, let's give them the services they need and then steer them out of the system, hopefully, or set them up for success. They don't need to come back to have additional services or have that duplication of service.
This is Nadia, and I go back to just that structural piece. So success for this group would mean that, we talked a little bit about people having to attend multiple meetings. So the ability for this group to accomplish work in an effective and efficient way. I know I've said this before, and I guess it's just the way my brain works, but I keep looking for some kind of an organizational chart as far as, what is the expectation for or the process in deciding the work that is done. What's the expectation for the data in making those decisions, and how is this group able to do that without, all the other steps, and be more effective than they have, more impactful than they have been able to be in the past.
Yeah, I appreciate that, Nadia. And those are things that we've talked about on other calls that you've been on and you're aware of. And I feel the same way. And I think the conversations today were really helpful, that we can, by understanding what success looks like for us, we can create that visualization of where we've come from and where we're going. And then we can get more of those structural elements around some of what you said, as far as making sure that we've got the right structure in place and the right responsibilities, the right framework to do all of the work.
Travis, if I could ask a random question. This is something that, as we're talking about this, that comes to my mind. So as a professional that really doesn't work with children near as frequently as the majority of people on this call, one of the tools that we use a lot in the hospital is the emergency services brochure that Buffalo Community Partners has, and we use that and hand that out a lot. Do we currently have something like that around child, youth, and adolescent resources, or is that something that we could also set as a goal for this group, is to have a professional resource base for professionals as well, in knowing how to connect people when you don't work necessarily in that environment? Sorry, that was a question and a question.
Region 3 does collaborate with South Central and Mid Plains and offer youth crisis support. They do have a handout. I would have to find it. I don't know if anybody else on this call has a copy of that, but That is often a resource we give to families because it's both, they can call into the crisis line, and if they need to, then go out with law enforcement to respond to the crisis.
There's other resources too, but I think that's a good idea to have some one-stop shop for crisis. I like that, Abby. I have two things I'd like to add. One of them, I would measure success in this group if there is some youth participating in this group. I would love to see some youth sitting on this committee and helping guide the work of the committee. And the other piece of that would just be that there be representation from all of those life domains that affect our youth and our kids in the committee, and the professionals that are sitting in the committee as well.
Great points. Thank you, Jamie.
I'm just going to jump in real quick and say, if Josh was on this call, he would 100% say yes, yes, yes. And I agree with that too.
Okay, go ahead.
Josh.
To keep us on track here, I will keep us moving along. Michelle, do you want to go over our communication plan?
Travis, I thought you'd never ask. I would love to. Though I see you took some time on my agenda. Good thing I'm a pretty fast female, so no sweat. So we've been working really hard on communicating what we've been doing with the collaborative. So I just wanted to go through a few things really quick. Nadia kind of talked already. We've been doing some revision to our mission statement. Really excited. We're going to do some like logo rebranding kind of as well. Hopefully towards the fall, we'll be able to roll that out. So just wanted to let you guys know that that is happening. We have been talking about a new tagline, building connections. That is something in the last few years, COVID, since COVID, post-COVID, our staff team really resonates with just building connections. So I know I sent out a PowerPoint to you guys in one of the emails I've sent. So hopefully you had a chance to just kind of look at that. But I'll tell you how that kind of came about. And Travis said he and Denise and Matt presented to Rotary last week or a few weeks ago, and we're able to use that. Let me see if I can share my screen here. I'm going to share this website. You'll have to let me know if my internet gets spotty here. So I've started trying to put together everything we've been doing with this collaborative. Like Travis said, it's been, it started somewhere and it's gone somewhere and now we're here. So I've really been trying to put that together so that you as a steering committee and as a collaborative can help share this with the community. We keep hearing, I want to share the work we're doing, but I don't know how. So first simple thing we did here is put together this website. You will see, again, I tried to use kind of the same graphics in the PowerPoint as well. But where we were before, you've all heard this, we were on separate coalitions, sitting in separate meetings. And like we talked about today, we heard it time and time again, we want to be in this collaborative space where we can all be talking together, right? Whether that's people with lived experience, people from cross sectors, we want us all to be talking together. So anyway, we've got data here. As Travis said, Mr. Matt is our amazing data guru. We've got full data documents here you can view. But basically with all of this data, we came out with these 4 areas that we really wanted to focus on. That led us to have a vision for the community. You guys will know we talked with so many community partners asking them, what's your vision for the community? So we've got that in there. We've got collective impact, those graphics. We've talked about how do we know we're creating an impact with the RBA, and down here to our collaborative structure, right? So I even have a list of all the collaborative members. If you click here, I've got this list of all of us here. So we've heard this is really important too, to just get a start of a list of everyone who's sitting on this collaborative. So kind of just the quick and dirty right now, but there it is. And then at the very bottom, I had this sign up. So unbeknownst to us, people started signing up. So Denise and I created a PowerPoint so that we could connect people with the work we're doing. So we've hosted a few Zoom sessions of talking to some new partners. Miss Sarah McNeil was one we did recently. So she was able to, we were able to just kind of pick her up to speed with what the collaborative work has been doing. So that's why I created that PowerPoint. And then again, Travis was able to use that as well with Rotary and just introducing people to our work. So my big question to you guys is, what else do you need to be able to communicate this work effectively to other people in the community?
Well, I will say that was amazing. Like that's a very professional. Number one, you lived up to the name. You are fast. That was great. But that looked awesome. I think that's you've created visuals. There isn't too much narrative in there where I think it's easy for people to digest. I think the main points get communicated pretty easily when you're getting a chance to take a look at that. Sometimes when you look at that type of information, you can get, there's too much narrative and you can get really lost in all of the wording on there. But I thought it was very high level, big picture, outlines what we're doing. And I'm amazed that we've got people that are already signing up, and that's how Sarah reached us. That's wonderful.
I know, it's crazy. I was like, what? People are signing up on this website. What's going on? I'm like, oh yeah, I built that. So thank you, Travis. I really appreciate that. Always looking for constructive feedback. So please let me know if you have other thoughts. I know the leadership team, we've been kind of floating some ideas of how to show some of this data a little bit more simply. And I think as we work into these work groups, launching the work group, that's something we really need to think about, right? What does the community need as kind of a big picture to see, to want to come and be interested in this work, right? Because we have to tell them something, we have to tell them enough. But if we give them the full data document, they're going to be like, see you later. They're not going to want to come sign up. So I think that's what Denise and the staff and I have just been really trying to work through, is what's that perfect amount of data to give people to make them want to come be involved. So the only other thing I was going to mention is to get people to the collaborative meetings. We've been doing just a lot of internal e-blasts. Hopefully you all have seen those coming through to your emails. We've got staff sending out emails to our coalition members to try to get them to come be involved in those collaborative meetings. And it seems like we've been successful in, so far, but I think when we really start to launch these work groups, we're going to need kind of all of you and hopefully the whole collaborative to be able to be inviting other people to those meetings. So again, that's kind of my final question to you, is what else do you need from the partners staff? What else do you need from us to be able to communicate to people the work that we're doing?
I would say one of the things that we need are stories. But the other thing also might be examples that maybe aren't lived, but examples that we see. I mean, so they don't need to be stories necessarily about individuals, but even examples of where we want to be and how we want to communicate. So I think that's always important, probably as important to the community as data.
Thank you, Dr. Schaefer. Great point. And we do use some of those stories. I know Travis and Denise used with Rotary. They told a lot of stories, right? So the data was maybe shown up on the screen, but then they told the story. So I think being able to present some of those stories in some kind of visual way or a script, I see maybe Emily put in, would be helpful. So I'll make a note of that. Thank you.
I do like that idea. If we could somehow get a couple of short videos, not 10-minute videos, but maybe 90-second to 2-minute videos on the website showing an impact story, and then having someone from this group sharing a story about their vision for the future, what we're trying to accomplish, kind of the elevator pitch. That might go nicely together as well. Great feedback.
I definitely have a script written for Nadia. I see she's still on the call here. Haven't mentioned it to her yet, but I'm like, oh, this would be great if Nadia could say this and I could video it. So we'll have to talk about that later.
We'll wait till she drops off so she can't tell us no. She gets voluntold. Oh, she gave a thumbs up. She's a willing participant. She's always so good. Okay, folks, I know that we've had a few people drop off already and want to be respectful of everyone's time. Is there, I guess just for housekeeping, you can see our larger well-being collaborative meeting is next Wednesday, the 27th, 12:30. Hopefully that's on all of your calendars. And then our next steering committee meeting will be May 19th. And gosh, now that I think of it, I won't be there. My wife and I are expecting baby number 4 in the middle of May. And so I will have a little bit of time off there. So good thing we've got this leadership structure now where I know that this group will still be in good hands, of course. So wish me luck, baby number 4. I'm not sure how that's all going to go.
I was just gonna say that. Good luck and congrats.
Anything else before we close out? All right. Have a great day, everyone. We'll talk to you later.
Thank you all.
Everyone.
Thanks, everybody.